All right, hello everyone. Today we're going to talk about the pressure gradient in the lungs and how it allows us to bring oxygen in and breathe carbon dioxide out. So, to explain that, we have this model of the lungs. So down here we have the diaphragm. The balloons here both represent the right and left lungs. This would be the trachea, and it branches off into the right and left bronchi. So in order for the lungs to expand and contract, there's accessory muscles that help with that. The diaphragm is one of these structures. There's also a certain law that we need to understand in order to know what's going on, and it's called Boyle's law. So it says that the pressure of a gas is inversely proportional to its volume. So the bigger the volume, the lower the pressure of the gas. So when we're breathing, the pressure outside is actually higher than the pressure in our lungs. So when we inhale, the volume increases inside of our lungs. As you can see, when I pull this down, the diaphragm pulls it down, the balloons get bigger, we inhale, volume increases, pressure decreases, and that allows air to come inside because the pressure is now lower than it would be in the atmosphere. And this is called negative pressure ventilation. So just to show that again, the diaphragm comes down, lungs expand because it's giving you a larger volume in the lungs. And then when it goes back up, they become smaller, volume becomes less, pressure goes up, and it pushes it back out into the atmosphere. So to explain that a little bit more, I have a picture here. And this shows the pressures of carbon dioxide and oxygen as they move through. So you can see coming in right over here is the venous blood, so that's coming from our body. The partial pressure of oxygen is 40, partial pressure of carbon dioxide is 46. When we breathe in, the partial pressure of oxygen in our alveoli is 104, and the partial pressure of carbon dioxide is 40. So as they go by each other, they have to even out this pressure gradient, and then it ends up the partial pressure being 100 for oxygen and then partial pressure being 40 for CO2. So then some of the carbon dioxide is leaving, so that's the stuff that we breathe out, get rid of that waste. And then oxygen that we bring in causes the larger pressure there, which it then goes and oxygenates our blood and goes to the rest of our body. So sometimes we need a little help breathing, and we may use CPAP. Show a picture here that shows the effects of CPAP. So normally the physical act of breathing helps get blood back to the heart. However, when we use artificial ventilations, there's still pressure inside the lungs after exhalation. So this increase in intrathoracic pressure decreases the area that the heart has, meaning not as much blood can get back into it and it can't make itself bigger. So this ends up decreasing cardiac output and in turn decreasing blood pressure. So you have to be aware when using positive pressure ventilations that you can end up decreasing people's blood pressure. So next we're going to talk about what happens if your ventilations are not adequate, which can happen if you're breathing either too fast or too slow. When we have hypoventilation or slow breathing, our body becomes hypoxic and there's an increase in waste products or carbon dioxide because we aren't breathing enough of it off. And then with this increase in carbon dioxide also comes an increase in carbonic acid, which the result is respiratory acidosis, which is shown over here. Some symptoms of that include headache, dizziness, decrease in blood pressure, and muscle weakness. Opposingly, hyperventilation, or when we breathe too fast, causes a decrease in carbon dioxide because we're breathing it off so fast, and also low oxygenation because we're breathing so fast that we aren't able to get the right amount of oxygen in. The decrease in carbon dioxide causes a decrease in carbonic acid, which becomes our makes our body become more basic, and that's called respiratory alkalosis, which is shown over here. Some symptoms of that include tachycardia, anxiety, and muscle cramping. So when you start breathing super fast, like with anxiety, that's when this commonly happens. Both hyperventilation can happen because of how the patient's breathing themselves, or because of a provider if they're giving artificial ventilations. And lastly, we're going to talk about one of the diseases that can cause damage to the chamber or the lungs, which is COPD. So specifically, the damage is caused to the alveoli and the bronchioles. The groupings of alveoli break down and become a large blob rather than separate little sacs. This was the healthy ones, and you can see there's little sacs here, and over here it's broken down and it's just one big sac. This decreases the surface area and makes gas exchange more difficult. On exhalation, air becomes trapped in the alveoli as well. With COPD, there's usually excessive mucus production as well as inflammation of the bronchioles. You can see here a normal healthy one, and then here how inflamed that is, which obviously makes it hard to exchange gases or breathe gases in. All of this combines to cause difficulty breathing or shortness of breath, barrel chest, tripoding is usually seen, and wheezing when you listen to lung sounds, as well as clubbing of the fingers because the oxygen isn't able to get there. This disease can't be corrected or cured in a pre-hospital setting, but EMS can assist the patient. And one way is to give the patient a nebulizer, which loosens up the mucus as well as dilating the bronchioles to make movement of air much easier. If in more extreme conditions, and if that doesn't work, the patient may require CPAP, which is constant positive pressure that helps keep the alveoli open during exhalation and allows for better gas exchange. All right, thank you guys. Hope you learned something.